Welcome to the Startup Grind.
So Startup Grind, for those of you who have never been before, we are a community for entrepreneurs designed to educate, inspire, and connect entrepreneurs around the world. Startup Grind started about 3.5, almost 4 years ago in a very small office space that was sort of commandeered by Derek, our founder. 5 people at that event. It's now grown to over 50 cities around the world, a community of over 40,000 entrepreneurs doing amazing things across 20 countries. So really have scaled quite a bit in the last few years. Pretty good. So now I'm going to introduce Hallie. Halle Tecco is co-founder and CEO of Rock Health. Rock Health is an organization based here in San Francisco that supports entrepreneurs innovating in digital health through a startup accelerator, events, and open source research. Hallie previously worked at Apple and Intel and founded yogabear.org. She earned her BS at Case Western Reserve University and an MBA from Harvard Business School. She is named one of CNN's 12 Entrepreneurs Reinventing Healthcare and also the Forbes 30 Under 30. So please join me in welcoming Halle Tecco of Rock Health.
That was very nice. Thank you.
So it's good to see you. We've been looking forward to having you for a while.
Yeah.
Things are really busy. In April,
yeah.
yes. So you're worth the wait. So lots happening in healthcare. So Startup Grind, we like to get to know a little bit about your journey to where you are today. So tell us a little bit about your background, where you grew up, what your parents did, kind of before you became internet famous.
Okay. Is this on?
Can you hear?
Okay. Can you hear it? Anyone from Ohio?
Yes.
Yay! So I was born and raised where in Ohio?
Dayton area.
Okay. I was born and raised in Northeast Ohio in a very boring town to a father who's an entrepreneur in manufacturing and my mom who did not work until my parents divorced. But I was raised pretty independently. My parents were a lot older when they had me. They were 37, and I think they were kind of done having kids, and so a lot of my childhood was just trying to entertain myself and learning to kind of navigate things. Like I remember making my own doctor's appointments, and I have siblings that were much older than me, 14, 16, 18 years older than me. And they were like additional parents. They weren't really like siblings. So I ended up going to college in Ohio, and then immediately needed to leave and moved out to California to work for Intel. And that's what brought me to Silicon Valley when I got kind of the startup bug and started dating someone who was working at a startup and hopped around at a couple startups myself before deciding that I wanted to go to business school. And really wanted to marry my interests in healthcare and technology. And at that time, there really wasn't a lot going on in the digital health space from the standpoint of the technology. So there was a lot going on from the healthcare providers, and they were trying different things out, but there still wasn't, and there still isn't today, a Facebook of healthcare or a sexy place to work in healthcare. And so I literally wrote in my business school application that this is what I wanted to do, and I wanted to find an intersection of applying technology in the healthcare space to reduce some of the inefficiencies. And then, luckily got into Harvard Business School and moved out to Boston, but always kept one foot here. And my now husband was living here, so spent a lot of time back and forth. And ended up getting a job between my first and second years at Apple, where I got to cover the healthcare and medical segment. So if anybody here has an app in the App Store and has tried to reach out to the App Store, that was my job on the other end, to work with you on setting pricing and thinking about marketing and editorial. And it was an amazing opportunity, and I loved working at Apple, and I would have gone back if I hadn't started Rock Health. But what I recognized was that the quality, the overall quality, none of you guys, all of your apps are awesome, but the overall quality of the apps that I was seeing was just a lot lower than the other segments, and it broke my heart, because healthcare is universal. It's something that touches all of our lives. Yet there wasn't that love for the details. There wasn't that creativity that I saw in gaming and lifestyle apps. And no offense to anyone working in those two spaces, because they're a lot of fun, but I thought so important to each and every one of us that it deserved the same amount of attention. And that experience really inspired the idea for Rock Health. I wanted to find a way to inspire and seek out entrepreneurs that would not be able to join the healthcare space otherwise, and give them all the support they need to really make a dent in the industry.
So what did you learn from Apple?
That's one
amazing.
breath, that's my whole story.
Okay, everybody go home.
Yeah.
No. So what did you learn from Apple that you sort of took with you through business school and then founding Rock Health?
Yeah. So I was there in 2010, so not too long ago, but what I learned was that mobile was the future, and it was really important, and healthcare and everything is really behind, so mobile had already kind of not peaked, but had a steep increase at that time in every other industry, and had revolutionized every other industry except for healthcare. And so I knew that was coming, the mobile health revolution. And what was really, we're gonna trade. What was, oh yeah, this is much better. What really resonated with me is that healthcare is always on and it's always with you, which is the same as your cell phone, right? So your iPhone is always on, it's always with you, and so the marriage of applications that can be tracking your health, monitoring your health, giving you access to providers at any time just made sense. But again, I was mostly inspired by what I didn't see than what I did see.
So you're at Harvard, and you come back from Apple, and what do you do that second year in your MBA that kind of helped you create what you did when you graduated?
Yeah, I found a doctor to work with me, and there was a program where you could start a company and they would kind of cover your travel and research costs, and so we came up with some research that we wanted to do around entrepreneurship in the healthcare ecosystem. And so it started out with us just doing tons of interviews with developers, designers, anyone that had a creative mindset and that were not in healthcare, as well as those that were in healthcare, to understand why more people weren't coming into healthcare. This is a huge $3 trillion industry. It's the biggest sector of our economy, yet entrepreneurs just weren't that interested in joining healthcare. And from that, we unearthed some findings on what were the perceived barriers. And so we looked at what entrepreneurs were saying were the barriers, and then we did our assessment on, is the FDA really that big of a barrier? And can we close that gap?
What were some of the fears or the barriers,
Sure.
perceived barriers?
Yeah, so regulation was a big one, and thinking that if I spend all of this time building an app, is the FDA just going to shut me down? And that was a perceived risk. And there's some truth to that. The FDA has not come out with any clear guidance on what turns a mobile phone into a medical device. If you put a medical app on a phone, does that turn it into a medical device? That's kind of still a little bit unclear to a lot of entrepreneurs. And the guidance is slowly coming out, but still we're not there. And so we thought, well, we can bring in experts that understand this, that can work with entrepreneurs to get over that fear. Okay, check. I think institutional sales is a huge one. So in any industry, selling into large organizations where there's a lot of bureaucracy and there's legacy systems is challenging, particularly in healthcare, where a lot of these organizations are changing rapidly and under very strict budget cuts. So what we did on that end, we realized, well, we could partner with some of the large organizations to speed up that sales cycle. And standardize some of that process. And then I think the third is really around funding. So there's a disproportionate amount of money going towards other sectors. I hate to pick on gaming again, but there at the time wasn't a lot of funding going into digital health, and that has absolutely grown year over year. And we decided, well, we can give money. We can find money and give it out as well.
So then you graduate and come back here, right?
Yeah.
And then start Rock Health immediately, pretty much. So
Yeah.
tell us about that process. And how did you get started? Who did you recruit to help you? And what is Rock Health?
Sure. So my second year of business school, we had a 4 or 5 week break, and I had gone in Boston to every VC. Anyone here from Boston? So I went to, and you guys know how Boston VCs are, they love to follow Silicon Valley money, but rarely put their money down first. I went to every VC in Boston and was just turned down time and time again by all of them, and was fortunate enough to have a couple of really good meetings and was able to raise like $500,000 in just a few weeks to get this thing started. And that was in winter break, so I still had a couple months of school left. So I completely slacked off my last semester, which was so ironic because I got the best grades. That it was just I didn't do well in business school, but that last semester I did well, and I didn't even try. But I made it so I only classes on Monday and Tuesday, and I was literally flying out here on Tuesday red eye every single week, and we launched at South by, so that was in March, and I still had.
That was 2011.
2011. So I still had a few months of school left, and I was out here, getting the office space ready and building a team and trying to figure out what the hell we were doing. We still don't know what we're doing, but trying to figure out all the details. And then literally like the day I graduated, the next day I was back out here. So I had a very different business school experience in that I've always had one foot back in Silicon Valley. I didn't quite want to leave.
So I heard that you're a not-for-profit accelerator, unlike some of the other ones like YC, but you're a for-profit.
We're a hybrid model. There's a nonprofit that was really created as a nonprofit so we could work with the medical system. So we work very closely with our kind of lead hospital partner, the Mayo Clinic, as well as UCSF, Harvard Medical School, Kaiser Permanente, and there are a lot of tricky nuances of working with hospitals. If anybody here has worked for a hospital, and early on they suggested that they could provide better services and partnerships with other nonprofits versus for-profits, and they couldn't establish a relationship. So we decided that it was really critical that we had medical partners on board, because if we didn't have medical partners on board, we weren't different from just technology accelerators. So we were like, okay, that's fine. We'll just create a nonprofit, which actually turned out to be a great thing because, we don't pay taxes on the income coming in, which isn't bad. But we're also able to create really great relationships with the medical community, and there's a trust there, and there's a transparency there. And we're also able to spend a significant amount of our resources on programming and resources that are valuable to the greater community they're not profitable, but we're incentivized to really help the greater good in digital health and really promote health innovation. And so it's not all about making money sometimes, it's about creating good. So that part has been wonderful. And then last year we decided that we were offering grants for the first three classes. We offered grants, and we decided that we could offer more money if it was actually in equity. So we created a syndicate of investors to be part of something called the Rock Health Fund, which is a for-profit fund. Mm-hmm. So we have kind of these two pieces, and the fund actually offers companies in Rock Health a $100K convertible note. And it's completely optional. So we do have companies that come in that say, we don't need funding, we're going to bootstrap. Or we found our own funding, and they're still able to benefit from Rock Health's resources.
What does a portfolio company get out of participating?
Yeah.
In the incubator?
So that's a big question. So the program is 4 months. We have typical. You can apply through AngelList. You can apply through our website. And we're really looking for team. It's really all about the team. Obviously, the idea has to be sound. It has to be scalable. It has to be a good fit for us. But at the end of the day, if we've learned anything, it's about the idea is going to evolve so much, and we're going to beat the idea until it works out. I'd like to say beat it to death. You can't say that in healthcare. But the things you can't say in healthcare, killing it, you can't say killing it in healthcare either. You can't say that's sick. You just you're limited. You're really limited. It's all about the team, and can the team withstand this? So healthcare is really hard, and things take a lot longer to get to fruition. And it's hard to see that in Silicon Valley when your friends are starting tech companies that are growing really fast, and you're still trying to get a hospital sign on or get a doctor to give you that meeting. And so a lot of what we screen for in team is like this personality. You have to be persistent, and we have to see that you're committed and dedicated, and it's not just that this is a great business opportunity, but you're genuinely passionate about changing healthcare, because you're going to have to be really passionate, because it's going to suck. It's going to be a really sucky road for a while.
So tell us about some of the entrepreneurs that you've worked with who are, I would say, non-health tech focused,
yeah.
Right? They've been in Silicon Valley for a while, but they have this great passion for doing something that matters. So
yeah. the majority of our entrepreneurs are coming from outside of healthcare. I can think of a few examples. So one of our teams, KitCheck, comes to mind because they just raised a record round for us. They just raised 10.4 million, which was really exciting for them, but they need to grow fast because what they're doing is kind of labor intensive to scale. But they came from the tech side. One was a software engineer, one was a RFID expert from Oracle, I think, and they decided that the RFID technology would be a great technology to apply within the hospital for digitizing the life science supply chain. And so actually having tracking on all of the items, eventually all of the items within the hospital. But where they decided to start was within the pharmacy, and every hospital has a pharmacy, so if you go to surgery, there's a kit and there's a certain amount of drugs that they'll be giving you throughout that 6-hour process, say. And right now, there's a very high cost to that because you have a pharmacist on staff that's not just doing kind of the high level stuff, but there's a lot of silly labor-intensive things like checking the bottle for expiration dates, or making sure that there were no recalls, or making sure that the entire kit is correct. And that's something that technology could easily do. If you just wanted to find all the recalled medications in your hospital pharmacy, that shouldn't take someone who has a professional degree to look through all the bottles. You should be able to detect that. And so that's this company, KitCheck, and they had no idea anything about the healthcare system, but now they have about a dozen hospitals that are paying them very good money to really digitize their pharmacies. We have some teams that come from really interesting design backgrounds. There's a startup called Kinsights, and they're building a platform for parents, Q&A, very local Q&A, Quora-like for parents. And it pulls in your child's medical records so that you can get relevant content based on any conditions that your child might have. And one of the designers came from LinkedIn, the other was from Postgres, and so they're really applying a kind of UX advantage to something that is now in Yahoo groups or parent groups. So that's another example.
So what about the hardware space? I mean, hardware has kind of had a resurgence, both in the non-health space as well as now in the health space. All the wearables, your misfit wearables.
I love hardware. Rock Health loves hardware. I think everybody loves hardware right now. It's easy to love because it's really exciting, but I think where hardware gets really interesting is when it's on the consumer side. So things when you can build something that would traditionally only have been within the healthcare system, and you bring it so that a consumer can have it. So an example is CellScope. You probably know CellScope as a mom. But they've built an attachment for the iPhone that turns the iPhone into an otoscope. And the otoscope is what doctors use to detect ear infections. So people do your children have ear infections?
The number one reason for pediatric visits.
Yeah, and it's usually chronic. Kids don't get ear infections once a childhood. They're getting them all the time, and it's costly and it's time consuming to go to the doctors. So now what they're doing is eventually you'll be able to buy their gadget on the shelves at Walgreens, put it on your iPhone. As a parent, you take a picture of your kid's ear, and the doctor sees that and can say yes or no if that's an ear infection. If it is, you can get the prescription right away.
So talk about the FDA and explain to those who aren't health tech people in the audience, what does the FDA do, why do they exist, and how do they inhibit or encourage entrepreneurship in this space?
Well, the FDA was really set up to protect, it is set up to protect consumers. And unfortunately, whenever you have a large government agency protecting consumers, you also have a lot of bureaucracy and a lot of standards and a lot of rules that can slow down the innovation process. Fortunately, the FDA has been working with the pharmaceutical industry for many years, has been working within the healthcare space for many years, so there are standards. What makes it tricky now is that they're just starting to see these devices that bring in the mobile phone, which is very different from the stuff that they're used to seeing. So right now the FDA is building out a mobile committee, and they're really thinking about where they draw the line for what we actually want to review or not. And so the general guideline is if you claim, so in your marketing and promotional materials, claim to either diagnose or treat a disease, then you need to go through FDA regulation because the consumer is counting on you to give them an answer and something that is traditionally done by a doctor. So you're replacing a doctor, and the FDA needs to make sure that your technology isn't bogus. And I think that's very important. We want good technology out there. We don't want things that are ripping people off and giving people wrong diagnoses. So that part is fair. But the process is lengthy and costly and confusing, and so we always recommend to our teams to hire an FDA consultant, which you can only do if you're funded. So it certainly is a barrier, but I think it can also be viewed as a competitive advantage because not everybody can get to that point. So if you're able to get through the process, you have a leg up on those who haven't.
Talk to us a little bit about the venture space and kind of the funding for healthcare, the range of health startups.
This is a great question, and I encourage you all to look up on SlideShare. If you just look up Rock Health funding reports, we put out a quarterly report on funding in the space. We have a very comprehensive database, so we're looking at the trends, the investors, the deals, et cetera. And there's just been tremendous growth. This year over last year was about 25% growth. Which is great for all of you guys. So there are two interesting things that I'd like to share about the funding space. One is that the digital health is a nascent space, and we're really looking at two groups of investors, so those from the technology space and those from the life science space that are best positioned to support digital health companies. And as such, no one's really an expert in the digital health space. So last year there were 180 investors investing in companies, but 80% of them only did one deal. So there's a lot of dabbling. There's a lot of investors who will try it out, and it's probably because they knew the entrepreneur and the entrepreneur convinced them that it's a great idea, and so they forgave that it was in healthcare. And so that's something that we're hoping changes. We hope that some of these companies do really well so that those investors want to really have a thesis around digital health. And the other thing that is really interesting, and I know there are a bunch of health entrepreneurs in here, so you guys have all, I'm sure, gone through the pains of this, is that there are no angel investors in the digital health space because there isn't a Facebook or Google that has IPO that has made wealthy former entrepreneurs who want to kind of pass it on. And that's a huge problem in digital health because angels are so important to the ecosystem and technology, and we're really missing that in digital health. So we're seeing companies that are fortunate to skip kind of the angel round and go straight into venture funding, which can be, there are pros and cons to that. And we're also seeing a lot of companies the consumer companies going to do crowdfunding. So Kickstarter. Which they've been kind of Scanadu
wow.
It was 1.6 million.
1.6 million in a month.
It's crazy.
Was it Indiegogo?
It was Indiegogo.
Biggest Indiegogo campaign ever.
Yeah, which is awesome.
And they're not yet cleared for FDA approval, so
the
consumers are voting with their dollars. So
yep.
I think more models like
that.
What about Vinod Khosla spoke last month, and he's been notorious for saying in 10 years 90% of doctors will be obsolete.
Yeah.
Do you believe that prediction?
I don't think that they'll be obsolete. I think that we're going to be shifting the work because right now doctors are wasting a lot of time on things that they shouldn't be doing. So productivity in the healthcare segment is a huge issue. And while the rest of the economy is becoming more productive, healthcare is not. And I think a lot of that is because doctors are spending a lot of time transcribing what's happening and doing a lot of notes, and they're having a hard time with EMRs, and they're, ear infection is a great example. Seeing a child with an ear infection over and over again, well, if you can see that, if machine learning can tell you that image is an ear infection, that's much more efficient than a doctor telling you that that's an ear infection, because that's actually really scalable and really cheap, whereas a doctor's time is not. So I think there are a lot of specifics within the healthcare system that should be automated, that shouldn't take a person, which then frees up doctors to do things that they're really good at and that we really need them for. And there's a human element in the healthcare system that we will always need, and that guidance and that support that a machine cannot replace. But there are a lot of things that machines can do way better than humans, and they should. And with that, I absolutely agree with the notes.
So what about the EMR space? There's a lot of EMR companies.
We incubated Dr. Chrono, which is a really interesting one that they're growing and doing really well. We know the Elation EMR folks; they're doing well. Practice Fusion's doing really well. So it's a huge market. We haven't gone too far into it other than Dr. Chrono, just because it's a very capital intensive business, and you have to kind of have all the features blown out. You can't really have an MVP in an EMR, so it's a tricky business, and we like things that can that we can actually help quickly.
So what are some things you haven't seen yet come through Rock Health that you'd love to see? Any entrepreneurs in the audience who are thinking of building something, what you wouldn't see in the next, say, year or 2 years?
Yeah, I'm personally really interested in remote continuous monitoring. So anything that you can wear, you're talking about this, anything you wear or that's in the home that can detect problems earlier or help consumers better understand your vitals at all time, I think is going to absolutely revolutionize the way we take care of ourselves and the way that we are interacting with the system. So we have a couple of companies in that space, in the remote monitoring space, that I'm really excited about and would love to see more of that.
What do you know now that you didn't know 2 years ago, and what would you advise companies wanting to get into the space on?
Yeah. Well, I knew nothing 2 years ago, so I've learned a lot. I think there is definitely a benefit in being naive, and the healthcare system doesn't appreciate that. There's this very old guard mentality in healthcare that some of you might have come up against, where you're either a doctor and you know everything, or, and are there any doctors in the room?
You know already.
All right. You're either a doctor and you know everything, or you're not. And unfortunately, the healthcare system for so long has been very siloed and unwelcoming to others. And I think it is so important that we bring some of these skills that we've learned in other sectors in our economy, like applying data, applying design principles in healthcare, because the tools that we have now are just like so lame. There's no excuse for it. Like, there are talented people that can help the healthcare system, and we want to open the doors for more people to participate. So I think when I came in to healthcare, I was very naive on how I would be portrayed as an outsider, and was certainly bumping up against people that didn't believe that technology had a place, and realized there's a way to you have to work with the system, knowing that the system doesn't really want to work with you. And so that's just another thing that you kind of have to overcome. You have to care about healthcare so much. You have to really believe that you can make a difference, so that you can create those relationships and bring diverse minds around the table, and really let them know that you're there to help. You're not trying to replace. And when it says things like 90% of doctors are going to be replaced, that doesn't help the doctors get excited about what you guys are working on, because they're like, shit, my job is at risk because these tech nerds are gonna outsource my job. Yeah, well, technology has had a dearth of women, and healthcare is really the same, that there aren't a lot of women climbing the ladder and getting to leadership positions. And so we started an initiative that a really wonderful woman named Anna runs. I don't think she's here tonight. To really support more women entrepreneurs and get more women excited about digital health. We think that women actually bring a really unique perspective to healthcare, because we make the majority of the healthcare decisions for the household. You might know this.
Chief medical officer.
Yeah, exactly. Yeah, women are the chief medical officer of the home, and so women can bring in a really unique perspective as a consumer and a buyer for both their health and their family's health. And so making sure that women have a voice and feel like there's an opportunity for them to be part of this industry is, I think, just really important. It's important for any industry, but I was really disappointed that we weren't seeing a lot of female applicants, and I think we've had 16% of our entrepreneurs are female, which is just not great. We can do way better.
Right?
I wish we could. And that's the goal, right? Like, we want to make sure that that women are welcomed into this industry. Women, you're welcome. I see a lot of ladies here.
So for those of us who aren't familiar with the whole, Obamacare, can you just explain that in plain English?
Yeah. Well, I don't even understand all of it, because there are a lot of pieces of it. But the main goal of the ACA, so Obamacare, is really around access. There are 50 million uninsured Americans, which is just disgusting and totally unacceptable. And it's one of the reasons why healthcare costs so much, is the uninsured then either are really healthy young people, like probably a lot of you don't have insurance, if you're a sole proprietor and can't afford it, but you're young and healthy, or those who are sick and can't afford it and end up going to the emergency room and costing taxpayer dollars.
Or uninsurable.
Or uninsurable, because they're, exactly, and they're getting rejected from insurance. So there are a couple of interesting interesting details within the ACA, and health insurance exchange is probably like the most talked about. You guys have probably heard it on NPR, but in 2014 there are going to be kind of open marketplaces, so small businesses and individuals can actually shop for insurance, and it'll be more like a marketplace where they're competing on prices and they're kind of set levels. But what this really means is that the insurance companies are going to start competing for business, and this is something that we haven't really traditionally had in healthcare. Traditionally, you end up getting the insurance that your employer has selected for you, and there's not much choice. But now that there will be more choice, and the insurance plans are going to have to compete on quality, they're going to start to be more innovative in their offerings, and they're going to need to bring down costs. And these are two places that insurance companies need to work with startups and innovators, because they don't know how to, they've been running an actuary business for so many years, they haven't had to differentiate. Now they're really starting to compete on brand. And so one opportunity is for startups to work with insurers, and many of our startups have been working with insurers to create programs that would be attractive to young people, to others that are not insured, that they want to be on their plan. And then the other part of that is they need to reduce their costs and their overhead. So any sort of services that can reduce the payer costs. So being able to identify patients that might be at high risk for something, so you can take care of a problem sooner than later. Any efficient, boring and unsexy things like automating call centers or billing. All of these are I think, opportunities that are opening up now that it's really insurance reform.
So talk to us about how does a startup, say a few gals in a garage, get traction with, say, the behemoth payers?
I haven't really figured that one out. It's really, 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 really hard, right? Because it's a chicken egg problem, right? Like you have to have a product that is desirable for them, that's fully built out, so that they can use it and try it. But you really have to have customers in order to get the money to build that. So it's really challenging.
And can you do lean startup in the health space?
Lean-ish startup, but but really no.
Like you should write that book, right?
The lean-ish
health startup.
Yeah, it's like the lean. It really is, because you're working with your customer has really high demands because lives are at stake, and it's completely different than anything else. Now I forgot what the question was. About a customer, how do you get customers?
How do you get customers? If your customers are payers,
Yeah.
or your customers are like the unique hospital.
What does not sell, unfortunately, are things that promise some sort of value. You will realize this value in the future. What really sells is something that has very immediate results. Like, if you use this technology, we are going to reduce your costs by 50%, and we're going to take 10% of that. And those sort of deals are very attractive. And the other piece is really, you have to prove that you can scale as fast as they need you to scale. So any large employer or large insurance companies, they're not going to roll you out on day one to all of their customers, but they will do pilots. And so what we've seen is them do regional pilots, and if those go well and meet certain milestones, then you kind of go on to the next stage. But you have to be able to scale with them. So if they can move as fast or as slow as they want, and so being really flexible with that is really important. The other thing that's kind of interesting that we're seeing in the insurance industry is that they're starting to acquire a lot of these companies. So having close relationships with them and building something that's really valuable, so valuable that they don't want their competitors to have it, they'll buy these companies. And we're seeing some very large acquisitions, well, relatively large. But there are some entrepreneurs that are becoming very attractive to the payers, because they're building something that they can't live without and they can't build in-house. And I actually was just on Tuesday, last Tuesday, so a week ago, they brought me out for a corporate offsite for one of the large insurers, because they don't know how to hire technical talent. And I didn't know what to say. I was like, I don't know. I mean, they think that they can just have your genes to work, and
so they're doing acqui-hires.
So they're exactly, and that's their only option at this point, because it's so hard for them to actually find talented people that want to work for a healthcare company or any big company. So, but specifically healthcare company, it's kind of hard. If you're going to do something in healthcare, you might as well do it on your own.
So you have an amazing sold-out Health Innovation Summit coming up this week.
Yeah.
Thursday, Friday, 200 people on the waiting list. That's amazing.
Yeah.
So tell us a little bit about that. Who's speaking? What is it about?
Yeah. Yeah, so our third annual, I feel like I feel bad doing this. Okay, we're having our third annual Health Innovation Summit Thursday and Friday at the W Hotel. But we are completely sold out, so if you don't have a ticket, you can't come, I'm sorry. But we do record everything, we put it online, so you guys will be able to view it. But we have,
live stream.
I think we're trying to live stream, but we will
Sell
definitely
tickets to the 200 who can't get in.
Yeah.
So.
Well, we definitely always record, so we have all of the videos from the past. This year we have a couple of really interesting speakers. So John Scully, who is the former CEO of Apple, he's been investing a lot in this space.
A lot in health tech.
A lot in this space. So
He's in Misfit?
He's in Misfit, he's in Audax Health, Medi Live. He's done about 6 deals in the space. Which is a lot for an angel. And so he's going to really talk about building an iconic healthcare company.
Mm-hmm.
Can it be done? Is there room for it? And his answer is yes. We have Steve Blank coming to talk about the leanish startup. The chancellor of UCSF is coming, and then we brought in a couple of CEOs from big healthcare companies like Fitbit and Castlight Health. So you can see it on our website, and you should all come next year. We really try to have our conferences be more like tech conferences and healthcare conferences. If anybody's been to a healthcare conference, you know that most of them are pretty boring and pretty negative in tone, whereas tech conferences are so inspiring and exciting and lots of positive energy. And so we started this innovation summit 2 years ago because we went to a large 20,000 person healthcare IT conference and ate really bad food, and we left really depressed, and we're like, why are we in healthcare? and then the month later was South by. I went to South by, and it was so much fun, and so we're like, that's what we need
South
in
by Health,
healthcare.
right?
Yeah, that's what we need in healthcare. So we have a little events team, and it's fun. So
It's great.
yeah.
So what do you see as, I know you can't predict the future, you could, be amazing, but next 10 years in healthcare, what do you think is going to happen?
A couple of things. I mentioned my interest in remote continuous monitoring, so hopefully we'll be able to all know our vitals at all times so that we can look at kind of on a more micro level. Right now we really get a snapshot of your health every time you go to the doctor, like once a year. If you're healthy, maybe even once every 3 years. And I think having kind of a continuous look at your vitals, your metabolic panel, looking at different things can help you make better short-term decisions like what to eat and how to move. And we're starting to see, obviously, there are tons of activity trackers, and I think that's a great first step into this market. But the next level are pieces of data that you can't see, but they can start to collect. Obviously, the baby boomers are creating a really big market, and there's huge opportunities there because there's a payment model. There's the nonprofit group that is creating Medicare that will actually pay for a lot of these tools because they need to make sure that there aren't heavy costs at the end. And so a lot of tools to keep the elderly in their home and healthy and happy, I think, is a huge opportunity. I think we're going to see more and more of that as people live longer. I think that just your notion of getting care and going to the doctors, One Medical is a really cool example of
Concierge medicine.
Concierge medicine. So there's a company called Better that just launched or is kind of in beta that Social Capital Partnership, Chamath, started with one of our advisors, Jeff Clapp, and their whole idea is like Uber, for doctors. So like on demand, you can just text and say, here's what's wrong with me.
Come to my
talk
house,
to someone.
right?
No, I think it's all virtual.
Oh, virtual.
Yeah, so it's all like, you can text like what, something, it's telemedicine, but a mobile version of that. I actually haven't used it yet because I don't think they have the beta yet, but soon. And I think that's huge, right? There's no reason you need to actually go into the doctors every time.
Because doctors don't even really touch you anymore. They still look at your throat and touch
Yeah.
you. Now you go and they just talk to you.
Well, there are a few pieces of the visit, right? There's the testing, and then there's like the conversation that you have, and yeah.
You can have a teleconversation.
You can get the testing elsewhere.
Weigh yourself on your wedding scale.
Yes, exactly.
So we'd love to open it up to questions. This is a great audience here. So we have a mic over, oh, where did I go? You know what?
You have
Mic.
You
I'm
have-
holding the mic, so I'm going to let you all pass around the mic, and if you have a question, raise your hand, or
I'm allowed to pass on questions.
Uh-huh.
They're too hard.
Hi, so I'm working in the digital health space, and my question is around distribution. So, you know, everybody here would pretty much say they're healthy if you ask them. And in creating a health app to help people, you want to be able to hit people when they feel they need it. In other words, gee, I need help. So how do you see kind of these startups gaining distribution, both kind of in the traditional ecosystem of payers and partners, but also getting to consumers through that?
Parts, and what we've seen is that the traditional ad model, so to acquire users, is actually really costly in healthcare.
Yeah.
So we had a company doing something that was similar to telemedicine in that space, and they were just completely priced out of ads, so the cost to acquire consumers was really high. So thinking about really creative ways to get to consumers, I think is really important.
We're doing applications for peer-to-peer location sharing and also expanding messaging and presence protocol. Yes. So can you think of any opportunities for, like, in a doctor send alerts? Would that be useful in this particular space? Like in a radius, like if they're coming, they can send alerts. How long before I get there? They can share where they are now, along with the next location.
No. Like maybe filling out paperwork before you get there could be helpful, but I'll think about it. Nothing comes to mind right now.
The supply chain and logistics management problem for the hospitals. I see some startups like Ethion come up with trucks that deliver medicines from the pharmaceutical to the patients or to the nurses. So do you think that logistics and supply chain handling is a problem in medical space?
You know, I think the right person to ask would be like the chief financial officer of a hospital who would know kind of the cost. My guess is that it's like everything in the healthcare system, probably more costly and less inefficient than it needs to be. I doubt they have optimized that yet.
How do you see continuous monitoring as an opportunity to really create value to a customer in a way that hasn't been available before?
Yeah. So there are disease-specific examples, and then there's just general health, the general health of understanding a patient's vitals in between visits. So as a professional doctor, you don't just see your patient snapshot once a year, but you can see how they've been since they've last seen you. In pregnancy would be a really good example. You know, that's a time where your body's going through a lot of changes, so these sort of numbers are really important to give a full picture. But I think chronic disease is a really interesting first kind of place to start. And I'll give you an example of one of our companies called Podimetrics, and they are changing their name right now. But I didn't suggest it, but yeah. So what they realized was that it was a multi-billion-dollar problem for diabetics, that they would have to get they would get gangrene, they would get issues where they would get ulcers on their feet, and they'd have to get them amputated. And that was a multi-billion-dollar problem because it was getting to this point where they'd have to get amputation, and there were so many million amputations a year due to this. And so what they've built is a monitor that is hidden inside a bath mat, and it scans your feet at night when you're brushing your teeth, and it can detect ulcers. You know, you're only going to the doctor once a year, maybe even twice a year, but it can detect ulcers faster than your doctor could. And so if it sees something that's irregular, it flags it, and your doctor can direct it and put attention to the issue before it becomes a problem, and hopefully prevent the very expensive and awful quality of life for an amputee.
One of the things you mentioned early on was when you first started in this space, you hadn't anticipated how the medical community would receive you as an outsider. Can you talk a little bit about the kind of allergic reactions that the system has to outsiders, and how, you know, some of your learnings can be applied to some of us who are navigating towards the space and wanting to not put our foot in our mouths when we have these first initial meetings with payers and providers.
Yeah. Can you clarify what you guys are doing? You said chart.
We're looking at public charge masters for discrepancies in charges for common procedures
Oh, okay.
that we can then expose to consumers in the way
Awesome.
they can use it.
So you're detecting pricing errors and overcharging and stuff like that?
Not even that. I mean, they're not necessarily errors. They're just the fact that one hospital will charge you
Oh.
10,000
Cost
Okay.
transparency.
Cost
Hospital B
transparency.
will charge you 20.
So like Gaslight for consumers.
Gaslight for people with not so much money.
Yeah. Cool. That's a very, very, very important space. So I think the one tactic that I've learned that I think has been really effective is to really ask them a lot of questions and really take it as an opportunity to learn. So I think I was like born a salesperson. I think I came out trying to sell my mom to take care of me for 18 years. And so I tended to kind of go into the meetings trying to sell what I had to offer. And I think what I've learned, over the years is that there's actually a dialogue to be had, and there's more that I can learn from a doctor than they can maybe learn from me. Maybe now it's equal, but then certainly I had more to learn. And so creating the relationship by understanding their pain points and genuinely caring about them and trying to address them. And even if you've heard the same thing from every doctor you pitch, still having kind of open ears so that they really feel like they're able to share their problems and that you can really tailor what it's perceived as you're tailoring it to them. Maybe it's not tailored. Hopefully you hear the problem over and over, and you're building something not for one doctor, but a pain point for all doctors. But going in there and saying, what's the hardest part of your job, and how can I, as a developer, make this better? What sort of tools could I create that makes your job better so that you can do what you want to do and help people and not do some of the burdensome administrative tasks? Or in your case, like how can I mean, yours is kind of hard because if they're a really expensive provider, you're not helping them.
There's a little conflict.
Yeah, so yours is a little different, but maybe if you ever want to go through to employers, like Gaslight, that was their strategy. For payers, yeah, exactly. So, when you're in those conversations, trying to understand what their pain points are, truly listening to them, and then saying, well, we've built something to help you. I want to help you, because you do want to help them.
What did you feel was the value of your business school degree in your work and what you did?
Yeah. Honestly, it was really just the network. They have this alumni directory, and I just went in there and I was like, healthcare. And then I was like literally cold calling people and seeing who I knew at every VC. So the network was really helpful. And then I think another aspect of something that I really gained was the classroom setting. Are there any MBAs here? Okay, get some representation. The classroom setting is really interesting because you're put on the spot. You have to have a dialogue with 90 people at once, at least at HBS, and you're cold called on. So you always have to be prepared, and you always have to be articulate, and you have just a very brief amount of time to argue your point. And just doing that every single day for so many months, there's something that kind of just changes in your brain where you're able to bullshit a lot better. And you're able to kind of pick something up, and that was really, really, really valuable. Yeah. HBS.
Hi, thank you very much. So we heard a lot about interesting startups in the consumer, patient, and physician space, and we talked a little bit about payers as an obstacle. But I'm wondering if there are other areas or stakeholders using it in the healthcare space, such as payers or pharmaceutical companies or medical education or compendium writers that you think are really underserved, and in what way do you think that is?
Yeah, so underserved or has big checkbooks? Because those are two different questions. I think there are a lot of people are underserved, but as an entrepreneur, let's think about who has big checkbooks. And I think one of the biggest opportunities right now is the pharmaceutical industry. One of our entrepreneurs, I don't know if he coined the term, but he coined it in my head. He said it's Farmageddon. Like the pharmaceutical companies are, they're very concerned about their current landscape, and it's more competitive than ever. They have a lot of pressure under them to discover drugs faster and cheaper than they do right now. And the percentage that they're spending on marketing is just insane. So I'm getting really excited, as should all of you, be around tools to help drug discovery move faster. So using data tools to help them find drugs faster, to help them find, to better source clinical trials, to make that process more efficient. There's a ton of money in it, and there's a ton of need. So.
Make it a three-part question. One is emerging markets, from India to Africa to China and so on and so forth. Looking at opportunity for the healthcare space, especially for women. I'm from Sierra Leone, so that's going to be freaking huge. Second, I'm in gaming, and I think that just for the educational side of it, one of the barriers for health apps is there's a scare for the consumer. There's an education barrier. I mean, if you want to market your healthcare app to a 70-year-old, she's going to be or he or she's going to be a little bit intimidated to work with that. So I think there's an opportunity as well for gaming to educate the consumer into healthcare. And lastly, I'm really fascinated that there aren't more women in the healthcare. In what you said, I mean, what do you think that you have to do, or what has to happen for that to happen?
The first two sounded like comments,
Yeah,
correct?
yeah.
All right. So if anybody didn't hear, he was saying there's just a huge opportunity in emerging markets, especially around care for women, and I absolutely agree with that. And I think there's just a lot lower regulatory burden. So if there are entrepreneurs with ties to other countries, thinking about that as your first market is a really unique strategy, and then bringing it over to the US once you have some trials under your belt, I think is great. The second thing you said was around gaming. I think that it's really tough. There are a lot of failed startups that thought they could just apply gaming mechanics to healthcare. Turns out healthcare is not that fun, and it's kind of awkward when you try to make it fun. And so I've seen a lot of I've seen a lot of failures there. So I'm kind of burned on like strict gaming. Rewards is another thing, but like let's make healthcare fun is, I think, a tough one. And then just the dearth of women in the space. I mean, I think that really is all startups, right? This isn't just a healthcare problem. I think we think it's even more important just because women actually have something very, very unique to offer healthcare over men. No offense, guys, but we touch the healthcare system in more points, and again, we're making more pricing decisions. So I would say it's similar to, I hate to say it's kind of, but it's just similar to like retail. Women have a lot to offer in retail as well, because they're making most of the retail purchasing decisions. But I think that the reasons are same across the board. We see a lot of women, obviously there are more women graduating college now than men. We're seeing a lot of women in kind of these entry-level or middle management positions. There are a lot of nurses. They're actually the same, more women in med school than men. But as you climb the ladder, more women are just dropping out of the workforce or opting not to take that next leadership position because maybe the workforce isn't as flexible as a woman would need it to be. So it's hard because at the same time, like with a startup, we have one person on staff who has kids, and that's it. And she just can't work as many hours as the rest of us. And at a certain point, you're competing with your coworkers. You're competing with other companies and their coworkers. And there's a certain point where, as a woman, you can't. There's only so much you can give. And so how do you create a work environment that doesn't disadvantage people that have second jobs at home?
Great, thank you so much for your time. What a wonderful time to be in the space in healthcare disrupting. Just with any final thoughts to inspire those of us here who are thinking about following the path of health entrepreneurship or digital health.
You guys are a really nice group, and I'd love to talk to some of you individually if you're working on things afterwards. I'd say, healthcare is really, really tough, and I encourage you, if you really care about changing the healthcare system, you can, and you have to be patient, and you have to be persistent, because this is a huge problem, and we're the only ones who are going to fix it. So, stay strong, and best of luck.
Thank you, Hallie.